I would love to welcome Prof. Vincenzo Vendinghi.
Yes.
Welcome.
Nice to meet you. So I am Professor Vincenzo Vendinghi. I'm full professor of plastic surgery at Padova University. My chief is Professor Bassetto, that is here also. So good evening, everyone, and I'll try to keep very shortly for the sake of longevity. So.
Sure. With Professor Vincenzo, we will explore the biological mechanism undergoing skin aging and discuss how modern therapeutic strategies are reshaping prevention, regeneration, and tissue preservation. So, Professor, skin aging is often viewed as an aesthetic concern. From a biological perspective, what does aging skin actually represent?
Yes, aging is a very important field of investigation both from biological and clinical point of view. And we think that aging of skin is not only an aesthetic issue, but can be considered as a morphofunctional problems for the patients. And the goal of modern aesthetic plastic surgeons is not to erase age, but we think that we should help people to age well. So to help women and men to be comfortable with their face. There are many biological issues that we could consider, and the main process include the collagen loss. We see these problems mainly in weight loss patients. Particularly in Padova, we have a big experience in weight loss patients and post-bariatric patients. And in aging skin, we observe also a reduced cell renewal, oxidative stress, and also this is an important focus mainly for the regenerative perspectives, because we observe a decreased regenerative capacity of the skin. And so we think also that it is very important from the clinical point of view, the role of for example, the biphasical peelings, because they have not only a resurfacing effect, but also promote the regeneration of the skin. So as physicians, we always try to promote the regeneration of the skin through a medical and physical device. It is very important to personalize our approach and also to follow the principles of precision medicines.
Thank you. Are we now moving towards strategies aimed at preserving tissue function before damages become clinically evident?
Yes, we observe that we have a paradigm shift from to a regenerative approach to the problem of skin aging. And so we have a lot of therapies of clinical possibilities. We are confident with cell-based therapies. There are a lot of research about the role of exosomes, growth factors, biomaterials, and other regenerative elements. From the surgical point of view, I am a plastic surgeon. We try to study the effect of endolift technology, for example, to improve the tightening of the skin, and to use the technologies that combine radio frequencies and helium plasma, for example, that is very useful to improve the tightening of the skin and to reduce the impact of the surgery on the patients.
Perfect. Regenerative medicine is rapidly entering clinical practice. Which regenerative approaches do you believe hold the greatest promise for the prevention and treatment of skin aging?
Yes, again, we are confident with cell therapies, mainly exosomes, autologous stem cells, like ex-plastic surgeons. We often use lipofilling, so the stromal fraction of adipose tissues, and biomaterials, and again, the new technologies like radiofrequencies and helium plasma.
Thank you. How do we balance patient exceptions with the biological realities of tissue regeneration and aging?
Yes, I think that patients should mainly understand that regeneration is a biological process that requires time. So natural and long-lasting results are more important than immediate change.
Thank you so much. Looking ahead, do you believe future anti-aging strategies will focus more on correction, regeneration, or prevention?
Both. I think that is very important preventions to reduce the physical stimuli to the skin and regeneration. I think that is most important field.
Thank you. If there is one concept physicians attending Life Scientifica Vitalis 2026 should remember regarding skin aging, what would be your key message?
The key message is that healthy aging starts with prevention. And by combining science, regenerations, and mainly personalized care, we can preserve skin function, quality, and well-being throughout life.
Thank you so much, and thank you for staying with us this late.
Thank you a lot. Bye.
Thank you.